It is great to have this conference at Carolinas Rehabilitation. From the TBI Model Systems is a nationally funded longitudinal research project, and so we have patients get admitted to rehab and then you can track their outcomes longitudinally throughout their life. We are one of those follow-up centers where we are tracking up to now 20-year follow-ups after injury, and so the people that are here are from all the different model system sites where they are also involved in this research.
The team here at Carolinas Rehabilitation, we're really focused on from start to finish. So not only do we see a patient from the inpatient side or on the acute side when they're at the hospital, we really do work on following them long term. And we work with them on the inpatient side. We work with an outpatient team as we follow them along their journey with traumatic brain injury and really work on anything we can do to get them back to leading as normal life as they can.
I talked about anoxic brain injury. As our population is getting older, we're seeing more cardiac arrests and more medical complications leading to an anoxic brain injury. And also with just the rising of the opiate epidemic in this country, we're seeing more of these younger patients that have drug overdoses leading to an anoxic brain injury. So it's just really important to be able to get them back to being as functional as they can be to help decrease the burden of care on their families and just overall in society, and then also being a resource for the community at large as to what kind of services are out there and what interventions can be done to help improve neurologic recovery.
I presented on paroxysmal sympathetic hyperactivity, which is one of the complications you see after severe traumatic brain injury. And with that, you can have severe complications associated with that. So I wanted to present on treatment options and what we can do to prevent the long-term effects from having that syndrome.
We get patients from a very large catchment area here in the southeast, and so we see a very wide variety with the very severe, and then also have patients that are not as severely injured and being able to treat over that whole spectrum.
There's wonderful research going on day to day here, but for me what brings me into work is working with families and the patients long term. And so here at Carolinas Rehabilitation, the focus is on the patient and how to help them best recover.